We've all seen comparisons of Spanish to English that help us work with children across languages. But what do we focus on in our English-only therapy with children who speak Spanish in other contexts, such as with friends or at home? Disproportionality, over-identification, and over-representation are all terms highlighting the fact that the proportion of English language learners in special education is higher than in general education. As professionals, we want to do our best for these kids, but part of the problem is that we don't always have the tools and information we need to make confident decisions about who we serve. If you feel this way, you are not alone. Less than 30% of speech pathologists reported being confident serving children from diverse backgrounds. Just a small number of studies have been conducted on phonological skills and bilingualism, but their results vary widely because of the different languages they studied, different ages of the kids, and different levels of bilingualism. Yet, here's what we want to know. Do the patterns of phonological processes in English differ from monolinguals and Spanish-English bilingual children? And how do we use this information to confidently make diagnostic and treatment decisions? We tested 322 students between age 3 and 9, using the bilingual articulation and phonology test, which tests all the phonemes in each position multiple times. Here's what we found. Just like with monolingual speakers, use of phonological processes diminishes over time. In Spanish, we see flap trill deviation, consonant cluster reduction, unstressed syllable deletion, gliding, and then less common processes. With bilingual children in English, what do we see? A lot more going on, right? And don't forget that these are typically developing children. Looking at them side by side, red is bilingual in English and blue represents monolingual English speakers, we see that bilingual speakers are using several processes more than their English-only counterparts. So why is that? When a speaker of another language does not have the sound or the process in the language they are trying to speak, they borrow the most similar sound or process from their first language and use it in their new language. For example, stopping was the most frequent process found. Spanish does not have the voiced or unvoiced th, saying the might come out as duh, or saying with might be produced wit. The sounds are stopped because they have the T and D in Spanish, which is the most similar, but not the voiced or unvoiced TH. Bilingual children have separate but interacting systems. What this means is that they will correctly use the phonological processes that are shared by the two languages and borrow sounds and processes from their first language. If we treat these processes as a disorder rather than a difference, we are going to end up with a large number of children on our caseload who shouldn't be there. Secondly, we will be focusing on goals that the child does not need to address, and we are not likely to experience success. If you want more information and need continuing education credits to help you serve bilingual students, this online course presents a rare comparison of monolingual in English to bilingual in English children to help us figure out what we should be focusing on to improve speech and move children off our caseload.